What's up, guys? I'm gonna do a little video now. It's gonna cover the Obamacare events for today as much as I can do, because I don't know how much time I can go for, but I'm gonna use this to respond to one of the creators on the left that I actually enjoy his show a lot. I think he has a lot of good content, basically. Very creative, good all around. Tim Black. He works with AJ Goodman and I think the Hard Bastard and a couple of other progressive creators. And I watch their videos a lot. I'm not even gonna pretend that I watch their videos a lot. I wouldn't say every day, but the issue that I take today, and I'm going to try to contact Tim Black and send this to him as a response, is that some progressives still are taking this position that the Affordable Care Act, aka Obamacare, was better than not having Obamacare, for lack of a better term. Or they're trying to say that repealing the bill, repealing Obamacare as a program, would be better than, would be worse than keeping it. So I have made the case for a while now that Obamacare is actually a policy that is a step back for both free market capitalists like myself and for progressives who believe in single-payer health care, which I also disagree with wholeheartedly, single-payer health care, but I actually can appreciate that it's a consistent position, because it's not a system where you have this ambiguity as to who has control, whether it's the state or the insurance companies or the hospitals or whatever. Single-payer health care effectively means what it says, that only one party pays into the health system, which is the government and by extension the taxpayer. So let's let Tim Black get started with his case. I don't know if we're going to get through all the video. It's not that long, but we got shit to do today.
We're fighting for our lives. We're fighting for our lives, literally fighting for our lives with the healthcare situation in America. And right now the Senate is trying to repeal Obamacare. But the problem with it is they don't have a replacement for the bill, for Obamacare, that will actually cover more people. Look, we don't want worse, we want better. There's not a long line for people who want to trade down. Not a long line of people who want to trade down on anything. Progression is where it's at. And this...
Okay, so right off the bat, I think you can tell that his enthusiasm is, I don't know, maybe he is enthusiastic about Obamacare, but I don't think so, because he's talking about trading up as opposed to trading down. Now, I think Tim Black, as opposed to a number of the other people on the left, is sort of disillusioned and of the mystique of the Obama era for a long time already, because as far as his domestic policy, Obamacare was the highlight, and it did not even scratch the surface of satisfying the progressive agenda as far as healthcare even. So what's his whole thing about people wanting to trade up as opposed to trading down, and that repeal would mean trading down? Well, as it happens, that's an inaccurate position, and I'll explain why. Yes, you can say that having no health care is worse, no health insurance is worse than having health insurance. However, when you look at the majority of people who have signed on to Obamacare, they have gotten health insurance, yes, but often they have been priced out of actually utilizing it. Therefore, if they were to file a claim under Obamacare, or seek let's say the help of an orthopedist. Let's say they were having bone pain or whatever it would be. Well, the deductibles under Obamacare would be too high for them to afford. So many of them end up foregoing care in order to be able to make ends meet. Here, I'll bring up a statistic. Okay, this was from November 14th, 2015, which was a little less than a year before the election. So what I'm trying to make the point of is that this has nothing to do with Donald Trump, nothing to do with Hillary Clinton for that matter. This is all to do with the Obamacare program. It does have to do with Obama because it was his system. So it says many say high deductibles make their health law insurance all but useless. Obamacare officials urging people to sign up for health insurance under the Affordable Care Act have trumpeted the low premiums available on the law's new marketplace. But for many consumers, the sticker shock is coming not on the front end when they purchase the plans, but on the back end when they get sick. Sky-high deductibles that are leaving some newly insured feeling nearly as vulnerable as they were before they had coverage. And this is from the New York Times. Okay, now the New York Times is hardly an anti-Obamacare publication. I mean, they've published numerous articles lately, and for that matter, the chief Obamacare apologist in the media, Paul Krugman, is one of the opinion guys on the New York Times. He writes his own. He has a column there, The Conscience of a Liberal. And that's the big booster for Obamacare. So this isn't a newspaper that's ideologically opposed to Obamacare. The deductible, $3,000 a year, makes it impossible to actually go to the doctor, said David R. Rhines, age 60, of Jefferson Township, New Jersey, a former hardware salesman with chronic knee pain. We have insurance but can't afford to use it. So, that's just an example. And, I'm not going to say that it hasn't helped anybody, but we're talking about making healthcare more affordable, not raising premiums or deductibles.
Senate GOP floating the scaled down healthcare bill is a travesty. A travesty. You understand what I'm saying? That's why the Save ACA is trending right now on Twitter. It should be trending now until August. Because it's that real, people. 22 million people will be kicked off health care. Let's clear up some misconceptions about Obamacare real quick. I never said Obamacare was perfect. In fact, I know a lot of people who are hurt by Obamacare because they got these high deductibles, they got high premiums, they get hit with the tax, right, if they don't get the Obamacare, okay? And I know a lot of businesses, small business people who have been suffering under Obamacare.
So let's rewind for a second. So Tim Black, I'm just going back for a second, he says something that I've been hearing a lot from both progressives and liberals that kind of shows how simplistic their thinking is. And I'm not blaming just him, okay? Because I do believe that he has, this isn't some shill for Obamacare. This is a guy who wants something else but can't bring himself to really oppose this policy because he honestly thinks that it was well-intentioned. It was not well-intentioned, and it really is not. In the end, even the people that were helped by Obamacare will eventually get nothing from it if it is not repealed. Now, notice what he said. He said, I am not claiming, here I'm pantomiming him, I am not claiming that Obamacare is perfect. Or I think he said, well, let's watch him do it.
22 million people will be kicked off health care. Let's clear up some misconceptions about Obamacare real quick. I never said Obamacare was perfect.
See, that's something I've heard dozens of times from people, dozens. As of yet, I've only met one person who's actually tried to defend Obamacare as a policy. Okay, they've tried to defend it, saying that there's a market for it, and therefore people are going to it is going to be offered. Well, that never ended up happening. In fact, there's been less and less providers that are into it. See, and then Tim Black goes on to say, you know, he knows people that have been personally affected by it. Their premiums have gone sky high, small businesses and everything, which I give him credit for. I think that there's a lot of people that are out there in the media, this dishonest media that we do have, that aren't willing to acknowledge even that. They'll just, you know, they won't deny it. They'll just ignore it entirely. The effect of Obamacare on small businesses has been catastrophic. In fact, it's pretty much made many companies, you know, just struggle. Those that have more than 50 employees, they struggle to keep those employees on their roles. And then at some point, many of them will fire them and then hire them back as independent contractors or something like that. Then they don't have to pay them Obamacare, or they don't have to provide an Obamacare. Those that are under the 50 employees will often deliberately not expand their or not hire more people just so that they can avoid paying Obamacare. It's a very, or Obamacare compliant plans. They do not want to be involved in it. They are getting basically just smothered by this heavily regulated charade called Obamacare. So let's go ahead and see what he addresses next.
Perfect. I have a show where I actually open up phone lines. People call in and they've told me their stories. If their stories are not fabricated, they're not being hired by Rush Limbaugh, they're not getting paid by, you know, Fox News. These are real people with real struggles, real situations. But there are people who benefited from it. In fact, before the Affordable Care Act, 50 million people had no health insurance. 50 million people. Now that we have the Affordable Care Act, 28 million people are still uninsured.
Okay, so what Tim Black says, and you know, I'm a little disappointed because I thought that he would look a little further into this. And I believe me, I like his show, and I like the shows of a lot of the people that work with him. But he's kind of being superficial here. Yes, if you take those numbers, the 50 million that were uninsured before Obamacare, you go down to 28 million now uninsured. But really, why did that happen? Okay, this is from PolitiFact, which is a source that they call themselves fact checkers, but you know, even I've debunked PolitiFact articles before, but here they rate half true a statement by Rand Paul, who was my candidate in 2016, where he says the vast majority of people that got insurance under President Obama's Obamacare, the Affordable Care Act, got it through Medicaid. So that's a real question that I'm going to have for Tim Black. Now, let's go down to their ruling. You know, let's skip all the bullshit. It says, Paul said the vast majority of people that got insurance under Obamacare got it through Medicaid. About 20 million people gained coverage, and about 14.5 million of those were under Medicaid or CHIP. CHIP is the Children's Health Insurance Program. But a sizable fraction of that 14.5 million were eligible before the Affordable Care Act took effect. One estimate said about a quarter of them were previously eligible. Another estimate put it as high as half. There is some guesswork behind all the reports. Medicaid might account for slightly more than half of those who gain coverage. Most people wouldn't say that amounts to the vast majority. But it is still likely the majority. So essentially, Tim Black, what he should have done with this, and you know, I'll tweet it to him. This let's put it this way, okay? If you are a single payer health insurance advocate, you should be even more against Obamacare based on this reasoning, because, okay, you have proof here, and I guess you can call it empirical proof, even though we're talking about a clipping from a fact checker. But think about it this way. Obamacare, this fake health insurance market, which is price controlled, it claims to have taken those 22 million people that Tim Black talks about and put them onto health insurance, whereas before they couldn't afford health insurance. Now, under this, it actually says only about 20 million. But, you know, the sources can be different. So let's say 20 million, just to be on the safe side, did get health insurance through Obamacare. Okay, fine. Now, all he has to say in order to claim, oh, single payer is better, because what is Medicaid? Medicaid is single payer health insurance, right, Tim Black? All he has to say is, well, under your Obamacare, still the majority of those people got it through Medicaid, which is single payer health care. So therefore, even if you don't like single payer health care, in order to do your phony baloney Obamacare, you still need to use it in order to make it work. That is, I mean, I'm actually making the argument for him. And what I would say as somebody who's against government health care in general, I would say, well, the whole problem is that Medicaid costs have inflated as a result of Obamacare, because it's put more people on Medicaid, and therefore Medicaid, which is a system that's uncapped, the costs are not capped, they're not budgeted. There's no budgeting with Medicaid. You have to pay for everything regardless of what it is. It has to come. The government has to shell out that cash. Therefore, because the providers, you know, the hospitals and practitioners, they don't get paid as much by Medicaid as they would through private health insurance. They compensate for it by raising premiums for health insurance policy owners, both Obamacare and non-Obamacare providers. So you're essentially giving an excellent reason why Obamacare is dysfunctional to the point where it requires Medicaid in order to actually function. Okay, and you know, I guess if there was no Medicaid, sure, it could technically function the way it has. However, you would still have a much smaller pool of people that could afford its health insurance, and very important, those people would be suffering from higher premiums because the price fixing does cause the premiums to go up. Okay, so they could have done the Obamacare without the Medicaid expansion. It would have been a much bigger disaster, because there would have been far fewer people that were eligible to get any health care. Forget about the so without the Medicaid, there would have been a pool of people much higher that would have been able to benefit from it. Now, one of the problems that, and you know, I don't know Tim Black, so I don't know whether he has insurance under Obamacare or under something else. Maybe he has one of these HSAs like I do, which I still have not experienced anything to really judge whether it's a good idea or not. So, you know, I'm not telling you what to do with your life. I'm just telling Tim Black this, okay? And I think he's you know, an honest enough creator to really acknowledge this. Those people that have not had to deal with the Obamacare structure, they do not know just how dysfunctional it is. Now, once you get into it and you have had to deal with the rising premiums and the rising deductibles, and like in the case of that New York Times article, an issue where, you know, the deductible is high enough that you don't even use your insurance until you've done that, or you've been doing the research like I have. And I think Tim Black should really go and do an in-depth project on this, and it would actually facilitate his case for single payer up to a point, even though I have counters for that. But you know, I'm going to give him some points just in order to move the discussion along. Let's see if he says anything, you know, to add to this.
Of 22 million people, okay? If we repeal Obamacare without replacing it with something that has more checks and balances in it to make sure people can get Medicare or get Medicaid or get coverage that they can afford, we will lose 22 million of the people who now have health care. So that's going back.
Okay, another incorrect assertion. I kind of he looks a little funny in that frame over there, but what's really funny is when he gets angry, though. That's kind of why I watch the show, because he can get pissed off. Anyway, so I'm gonna move it along just so.
Backwards.
So I kind of want to go on his show one day and just like see if I can get some like funny reactions out of him, but you know, Tim Black is, again, he's sort of, and it's sad because the other elements of the neoliberal propaganda, they usually don't buy, but with this they do. They claim that these 22 million people will lose their insurance through the repeal. What they are not processing from the news, because, you know, I think if you actually read a lot of these business newspapers, IBD and Bloomberg and whatever, these people are already losing their health insurance often several times a year. Like some of these insurance providers will leave Obamacare, as United Healthcare did, Anthem did, and whatever, and automatically they can jump onto another Obamacare plan, but the pools are getting smaller and smaller in terms of, or the markets are getting smaller, the exchanges are getting smaller. There's less and less providers that are willing to sell on the exchanges. So, very important. Eventually, in some of these areas, there's actually not enough people to actually justify providing a plan, so the providers all disappear. That's already happened in several counties in the U.S. I think in Tennessee it happened. I've done a few videos on it. Colorado, Georgia, huge part of Georgia has absolutely no coverage. Missouri, and even in areas where there is coverage, but there's only one provider, the premium hikes are just astronomical. Last year, I think, in Arizona, there was a premium hike of over 100% for some plans. And I'm not, and again, I have to be careful, because then somebody is going to come to me and say, hey, why are you making generalizations? My plan only went up by 55%. Well, I'm going by the averages reported in the news there. Like it would be channel, you know, the NBC affiliate in Phoenix was the one I used last year when it was happening. So, you know, you can go and look it up. In all of these states, the premiums just keep going up, and in some districts and counties, there is no Obamacare. So his whole premise that you're going to be taking health insurance away from 22 million people is fallacious. That health insurance is already disappearing, and the health insurance that they have is not affordable. So his premise is that Obamacare is better than nothing, and I would argue that it's actually worse than even even his idea, which in my opinion is a bad idea. His idea would be single payer, but Obamacare is in some cases worse than single payer, and I'll explain, you know, kind of why. Why in some cases, in some respects, it's worse than single payer. And I'm definitely not going to get through his entire video, but, you know, maybe I'll do a sequel or something. Look, there's a number of reasons why Obamacare is just a total train wreck. And they're not all to do with its own structure. One of the reasons is that the health insurance, it did nothing to reform malpractice law, which is driving up the cost of physician insurance. They need to pay insurance so that they don't get sued. And that, you know, I'm not for doctors having impunity, but you cannot have these people paying, you know, I guess in some cases it's tens of thousands of dollars a year. In other cases, and you know, it'll go up because the more times you're sued. Let's say a cardiologist might get sued more than, you know, a podiatrist. You know, there's real issues as far as malpractice insurance driving up the costs of care because it gets passed along. Any cost that's associated with the healthcare industry gets passed along to the consumer. And that's why somebody like me, who's not a healthcare professional, the closest I've gotten to healthcare was working for a medical devices company, which is I'm about to get to. Okay? Any cost that you associate with any given industry gets passed along to the consumer. So this malpractice insurance is one of those passed on costs. What's another passed on cost? The Medicaid claims. I've already addressed that. Okay, so I'm not going to go over that again and, you know, toot my horn. That is passed along to the insurance consumer, and that's the way it works under the ACA too. So, you know, this is a system that simultaneously you're adding more people to the rolls of Medicaid, which has always been feeding and the rising medical costs, the rising insurance costs. It's been Medicaid because that is paid for by the people that own private policies. Now that you have Obamacare, which facilitates more people going on Medicaid, which is not Obamacare, the people that go on Obamacare now get their premiums. You know, the price just keeps getting boosted. You know, okay, so I did go over again. Sorry, guys. And then, okay, so understand that you have the malpractice, you have the Medicaid expansion. Another unseen cost, which I guess may not be the most important one, but it is an important one, is the taxes on medical devices and the regulation by the FDA of pharmaceuticals and the medical industry. Now, you might think it's essential for these things to be regulated as much as possible so that consumers are not given, you know, basically snake oil and, you know, or they have to go through, you know, using a syringe that basically impales you or whatever it is that you know, your devices need to be safe, your pharmaceuticals need to be safe. There's no argument there. And you know, I can't make the case that all the regulation is bad because I haven't read it all. Okay, so I'm not trying to say that. However, the regulation that I've seen, a lot of it, you know, related to lead content and components that, you know, for example, they've not even used close to the patient. They're basically located in a different room. It's not even an issue of patient contamination. You know, and there's other things like the radiation exposure. I guess you can't go crazy with that, but in some cases, I'd say they go a little overboard. You know, with the radiological equipment where, you know, they're being a little too far on the cautious side. Again, I'm not telling them to play with fucking plutonium in their hands. It's actually not plutonium, but I think it's cesium that they use. Anyway, so I'm getting really sidetracked and in the weeds because this is the area where I actually dealt with a little. But this overregulation is a major problem because it prevents those products from reaching the marketplace, and because of the compliance issue, and you have to pay in order to comply. First of all, you have to pay auditors to come in and ensure your compliance. Then you have to pay people on the inside that will monitor that your procedures themselves are compliant. Then you often need to you know, file the paperwork, and often deal with claims against you and deviations and whatever. It adds time, it adds money. And then once that device makes it to the market and you have this very compliant, whatever it is, scalpel, let's say, the most simple medical device. Okay, so you've added probably several orders of magnitude of cost onto it. So this scalpel that may have cost, let's say, $3 without this crazy regulation will now cost $35, let's say. I'm bringing in imaginary numbers. Now, I've seen firsthand how projects, and you know, I didn't work in this industry for many years, but I've talked to people that have, and I've heard people talk about it, and I've seen you know, presentations about it. That will, you know, it'll move that medical innovation down, you know, several years. A device that would have been on the market if a lot of these roadblocks were gone in 3 years may take 9 years to be put on the market. The same thing for a certain medication. So all this cost, first of all, it's adding cost. So by the time it makes it to market, the pharmaceutical company or the device designer needs to recoup their cost in one way or another. Otherwise, they wouldn't want to stay in business. Why would you want to sell something that you lose money on? You wouldn't do it. So those regulations, they really do need to be reformed, and I think they should do so thoughtfully. I mean, I can't say for the record that they can all go, because that would be a lie. I'd be deceiving you. A lot of these regulations, you know, they are, for lack of a better word, they're necessary. So, you know, but there has to be a reform around it. Some of them are necessary, but a lot of them are just a complete waste of time. Finally, you know, there's an issue of the pharmaceutical companies and their you know, goings on with dealing with patients and trying to you know, promote their pharmaceuticals through doctors and whatever, and you know, that's come to the fore with the whole opioid epidemic and whatever. So I'm kind of gonna have to go, but this is a debate that has to be made with a lot of boring sidebars, which I've already put up, and you know, I'd be willing to talk to any of these guys about it. I don't care that they're single-payer advocates, because they I think are a little more honest than the Obamacare people. But when they go on and he has this hashtag up, hashtag Save ACA, no. I'm asking you, Tim Black and you know, H.A. Goodman, you have to reconsider your position on that. If nothing else, I'm not going to convince you to be free market capitalists, and you are not going to convince me to support single payer under any condition. I would rather, you know, be given. Actually, I think in Mexico they have single payer. So I was about to say, and then now I'm getting in trouble for something else. But I would rather get you know, faith healing than deal with the single payer system, because that's how much I don't believe in it. Okay, it's just a complete lie, and that would take a different discussion. But the Obamacare issue has to be understood in the proper context. Obamacare was a step backward for the people in market healthcare, and it was also a step back for the people that believe in single payer, because it created a price-fixed, subsidized charade, which was the Obamacare market. You were getting basically corporate welfare health insurance that was unsustainable, was overregulated corporate welfare, and what should never be forgotten. This is another part that I wanted to go into that I don't talk about as much or don't emphasize. And that'll be the last point. Don't forget all of the waste that went into crafting Obamacare, enforcing it, all the collections made on it, all the waste in advertising it. It has to be advertised, by the way. I used to get emails all the time about it, and I'd see advertisements outside in the streets about it. Come get covered, whatever. They spent a lot of money for this failure. And as the PolitiFact article demonstrated, they have gained very few people for actual Obamacare. They may have had as little as 9 million people covered. And I don't know, sometimes I see conflicting numbers, but it should be regarded as a failure already. The only thing preventing Obamacare from being repudiated by the entire country is the stubborn insistence by the media and their Democratic masters on creating this charade that it can be fixed and whatever. They want to say, oh, well, Obamacare can't be repealed, it has to be fixed. What they really mean by fixing it is to give more corporate welfare, to basically bribe some insurance providers to come back into the plan. And I don't think it'll work. I think that all those insurance providers know is that it's so expensive and inefficient that they might as well just stay out and watch it fail. So anyway, I'm going to share this video on YouTube. I'm going to try to share it with this YouTube creator, Tim Black, and hopefully he maybe like discusses it more openly, like tries to like explore it a little more. I mean, I understand sometimes people don't even see what I provide or see what I tweet, but you know, there's a lot of people that are in the same stage of knowing about the Affordable Care Act. It was such a bad bill that until about a year and a half ago, I knew that I opposed it, but I didn't know why. So I did the research and I figured out why I really need to oppose this bill and devote a large amount of time to fighting against it. And I think that these guys should too, because, you know, either way, I can't just, you know, sit by and say, hey, Obama, I guess it's fine because Obamacare is fucking the progressives too, and I don't like progressives. I mean, would that be the logical thing to do, to say, hey, I fucking hate it, but it fucks them too? No, because that doesn't really help anybody. It doesn't. You know, if we're all fucking stuck in the mud, then we're just wrestling each other to the bottom of the fucking tar pit or mud pit, whatever the hell it is. So have a good night. This is Ramon, bold like a leopard. Repeal Obamacare. I know that the Senate did the vote today to start the debate. I am not going to celebrate until there's an actual repeal and hopefully a full repeal, like Senator Paul wanted. But I don't know what the fuck's going to happen. Anything could happen at this point. And I've known not to count my eggs before they've hatched.